This show is produced by the Hartman Media Company. For more information and links to all our great podcasts, visit hartmanmedia.com.
Welcome to the Holistic Survival Show with Jason Hartman. The economic storm brewing around the world is set to spill into all aspects of our lives. Are you prepared? Where are you going to turn for the critical life skills necessary to survive and prosper? The Holistic Survival Show is your family's insurance for a better life. Jason will teach you to think independently, to understand threats, and how to create the ultimate action plan. Sudden change or worst case scenario, you'll be ready. Welcome to Holistic Survival, your key resource for protecting the people, places, and profits you care about in uncertain times. Ladies and gentlemen, your host, Jason Hartman.
It's my pleasure to welcome Cynthia Fisher. She is founder and chairman of Patient Rights Advocate, otherwise known as PRA. She's a life sciences entrepreneur. She's founded a couple of other ventures, including Viacord, which is a umbilical cord blood stem cell banking service, and a cellular medicine company called ViaCell. Cynthia, welcome. How are you?
I'm fine. It's a pleasure to be here, Jason.
It's good to have you. Where are you located?
I'm in Boston, Massachusetts.
Fantastic. Well, I love that it seems like finally hospital pricing might actually become more and more transparent. Now, Trump did an executive order on that recently. I remember seeing that in the news. But the process is not complete yet. Like, I mean, if I go to a hospital's website right now, am I going to see their prices like I should, like I do for pretty much everything else in my life? I can see the price before I decide to become a customer, but somehow in medicine, it's murky. Why? There's no reason for that.
You are so right about that, Jason. And nowhere in any other marketplace is the American consumer blindfolded to not see a price before we get care like we are in healthcare. Yeah. And what's even worse,
the legal system is that way too, but that's another discussion. Okay, go ahead.
But the other thing about healthcare is not only do we not get to see the price today, but on top of it, we get blindsided by prices we never knew we'd have to pay, right? Yeah. And then finish that off with having to pay with a blank check, whatever the hospital chooses to charge us. And then we have no recourse because we never got to see the price in the first place. But like you said, in any other industry, we see the prices and we get to benefit from competition, and we get to be empowered with our own choice to purchase things we can afford. And the same thing can apply to healthcare. And so, yes, the president and the Trump administration did do an executive order and a hospital rule to make hospitals in January of 2021 have to show their real cash prices along with the negotiated rates. So the good news is they also have an insurance rule, so that can you imagine that we could actually see what our insurance company negotiated compared to other insurance companies and whether they're giving us a good deal or not? So when we, the consumer, are empowered with insurance companies and hospitals having to show the real prices, that changes the game. That puts us in control.
Just out of curiosity, what's the better price going to be? Maybe it's not always this way, but usually, is it going to be the cash price or the price your insurance company is paying?
Great question. Well, Dr. Larry Van Horn of Vanderbilt, an economist, looked at that very question and looked at historical claims data across the country to find out, was a cash price better or was a negotiated rate better? And guess what he found? He found that cash prices, if you paid directly to that care provider at a cash price, those cash prices in general are 39% cheaper, lower than the negotiated rates, the best of negotiated rates across the country. So the insurance
company is getting taken for a ride then. Now that surprises me. I remember years ago I used to have a girlfriend that was a contract negotiator for an old insurance company. I haven't heard of it in years, but FHP was the name of them. And, that's what she did. You'd think that the pros would go in and negotiate great deals. But then again, the hospital has so much work, paperwork, compliance work to deal with all of the insurance crap. I can see why they'd want to charge more, frankly. But what do you say to that?
Well, what I say to that is it's not really the insurance company benefiting, because the insurance companies actually are getting us paying in advance out of our paychecks, right? So we automatically get, on average, 30% of our paycheck. We pay 30% of healthcare. Our employer pays 70%. And we're paying for that coverage in advance of any care, right? That goes straight to the insurance companies. The people that really pay for healthcare are us. It's we, the American people, the consumer, the patient, the worker, and the employer, and the taxpayer.
We get
it's
it,
not
but
the insurance
you know
companies,
what I mean.
But I know what you mean. And I think the real issue is that the insurers negotiate a rate, and then they provide that to our employer coverage, right? 181 million people are covered. And the real issue is the only way we can lower the cost of those negotiated rates or lower the cost of the cash rates even more is to see the prices. And the best thing is, Jason, we are at a moment in time that's unique and special.
Right.
We are in this COVID crisis where people's lives have been devastated by being, now many are unemployed, and many are worried about where do they get their next paycheck? Where do they get the next food on their table and money in their pocket? And in this time, healthcare, our broken healthcare system, and this health crisis has had a devastating effect on our economy. And yet we're going into one more stimulus as taxpayers that Congress is looking to add one more boost to our economy to get us back to work. They might
add a lot more than this next one, but go ahead. We've got this one coming. And so this is a chance to use, wrongly credited to Rahm Emanuel. It's Winston Churchill's quote, which is, "Don't let a good crisis go to
yes,
waste."
Thank you.
And Rahm Emanuel doesn't deserve credit. Okay. And so what we can do here, you were telling me off air, is pretty cool, right? Tell us what opportunity we have here to really fix the system with this next stimulus package.
Yes. In this next round of stimulus, it is absolutely critical to protect patients, employers, and taxpayers by insisting that healthcare price transparency is part of the COVID package. Simply what Congress can do is they can codify the Trump administration rules, making healthcare prices transparent. And that empowers us, the consumer, to be able to shop. And then we can shop for the best quality of care at the lowest price. And bend down the curve of these runaway healthcare costs, stop it, put it in reverse, and benefit by reducing the cost of both care and coverage.
Okay, so I don't know if you clearly answered the question, Cynthia, that I asked at the beginning. Maybe you did, so forgive me if you did. But we're not all the way there on this transparency, right? Distinguish that for us. Like, the prices, are they posted on the hospital's websites now? Is that the law? The executive order?
Well, right now, the hospitals post a funny number. It's called a charge master rate. It's not a real number.
Charge master rate. What does that mean?
Yeah, it's a very high rate. It's not the negotiated rate. It's not the cash rate. It's a very high rate that isn't a real number. And what we need, and that was required by Health and Human Services to start posting their rates, and that's the number they posted. What we really need them to do is post the real prices. What is the real cash price? What are the negotiated rates for that MRI? If I'm going to go get an MRI, what is it?
Okay, so this is what you want to be in the next stimulus bill. You want to make that law, right?
Absolutely.
Okay, got it.
Absolutely. And we're at this moment in time, like you said, let's not let a good crisis go to waste. These rules have already been baked. They're already done. And all we need to do is make them permanent by putting them into law. And so if you think about it, in this next round of stimulus, Senate nearly needs to say, we want to codify the rules for making hospitals and insurers reveal the real prices and the negotiated rates before we get care, so that the American consumer can be in control. And guess what, Jason? 88% of all American voters in the Harvard-Harris poll of last year said they support these government mandates to know prices before we get care. And in the last stimulus, the hospitals got over almost $200 billion. And now in this next stimulus, they've asked for $100 billion more with no accountability, no oversight, no transparency. Well, you know what? We, the taxpayer, are paying those hundreds of billions and trillions of dollars to our economy to help bring it back. But to the healthcare system, in exchange for what the hospitals have gotten, and they want more, all we need to do is in this next stimulus say, give us, we the people, the American public, the right to see prices before we get care.
Why is the executive order inadequate? Why do we need another thing here?
Well, guess what happened after the administration released its final rule, making the hospitals show prices?
Well, what else? It's the American way litigation. I mean, of course.
They sued. Yeah. And actually, the hearing was just a couple of weeks ago where we're waiting for the judge to come out with the verdict. But they sued using the First Amendment to say, wait a minute, we have the right as hospitals and insurance companies to have our gag orders and our secret hidden prices as part of our freedom of speech.
It's like they're using the First Amendment in reverse. That's kind of funny. I would think they would use, it seems like they should use the Fifth Amendment. They have the right not to incriminate themselves.
Well, in fact, they even argue that prices will go up because they'll collude if they see each other's prices. But guess what? You know, that's a ridiculous argument because we know as consumers in any market where we get to choose and shop, we can drive down the cost at a price we can afford.
And the prices it would make it, they'll all want to beat each other's prices. That's the way the free market works, God bless it. And so if they post their prices, their competitors are going to look on their website and see, hey, if you want a heart transplant and you go to that hospital, we got to beat them by $1. We got to have a better deal.
Exactly. And we have actual empirical evidence where physicians and surgeons that have left the opaque world and wanted to do honest pricing at a guaranteed price, like OSS Surgical in York, Pennsylvania, or Texas Free Market, or Oklahoma Surgical, they post their prices online. Right. You can get a knee replacement for $15,000. And then they stand behind that price. Yeah. And an opaque hospital system an hour away charges $75,000. Yeah, that's a huge difference.
It's a complete absurdity, but you know, exactly. You're going to mess up your knee by going so far to get there. So that's why. Anyway, I'm joking.
Well, you know, the beauty is, but wait. When we have free market, though, Jason, you're a financial guy. Yeah. You know that if we know from Oklahoma Surgical, they've told us already. A woman in Georgia says, I can get a procedure for a guaranteed price of $4,000 at your center. I was told set $40,000 in Georgia. Well, she used their online price to negotiate in Georgia, so she didn't have to travel.
Right, exactly.
She got to use it as negotiating leverage.
Exactly.
And then we also exposed. We know that they're wrong with their argument that prices will go up because not only from the actual evidence of this happening in a small way in the marketplace today, but more broadly, we know that from the cash data that I told you about earlier, Larry Van Horn, that prices go down. And when employers are able to direct contract with these price transparent surgeons and physicians, they've saved 30 to 50% on their healthcare coverage for all their employees. And they add the money back into the employee wages. Yeah, this is an economic stimulus.
It's better. It's better for everybody. You don't have to convince us, Cynthia. I mean, my audience understands the free market and they are for it. I want to switch gears for a moment, though. Let's talk about COVID-19 for a moment, okay? So how badly have the hospitals been hurt by this? Or have they? We've all heard the stories about them misclassifying the deaths intentionally. You know, if someone was already going to die of diabetes, heart disease, lung cancer, whatever, but they happen to have a positive COVID test, you know, they call it COVID-19 was the cause of death, which it wasn't. And it seems to me that would, you know, the old concept is, and it's true throughout every area of human life, and it's so simple. What gets rewarded gets repeated. What gets rewarded gets repeated. So when the federal government came out and said, look, we will just pay for anybody if they have COVID, right? You know, and so of course, the hospitals have a complete incentive to have everybody have COVID because they know that the feds will just print the money to pay for it instead of having to do insurance work or go to collections to try to collect from the patient. So, of course, they're going to say it's COVID, right? I mean, that seems obvious, isn't it?
Well, we've actually, to your point, and actually had complaints come into our email addresses, and we've been contacted by patients that have been misdiagnosed, misclassified as COVID. In fact, one had emphysema, and he went to the hospital, and his whole treatment in the emergency department, where he's gone for treatments in the past with emphysema, his comparative prices from past visits where he's had and struggled, same treatments, were around $2,500. But what he found instead is he got a $13,000 bill for suspected treatment for his COPD as suspected COVID. So they added nearly over 10,000 more.
Okay,
to
so
the
my
bill.
question is, have the hospitals been hurt by COVID-19, or have they used it as an excuse to just steal from the government?
Well, it goes, to your point, I think it works both ways. One is, on one hand, without transparency, without seeing prices, without transparency and validation that there really was COVID, right? Mm-hmm. Testing is now more prevalent, and we should actually have confirmatory whether or not they could bill for COVID, right? Not just quote unquote suspected COVID. So you're right. And I would say without that transparency, without that accountability, without the prices, then the government will be continued to be gamed. And patients are being gamed. So I'll give you another example. We had another patient come to us who just got tested. She went to a tent outside an emergency room. Mm-hmm. And you know what her price was? She got billed by the hospital, which the government said they're going to cover the test. Well, the government's covering the test for $35 to $100 in the range, depending on the test, the serologic blood stick test. But she got $6,000 of charges. When another patient here in the Massachusetts area went to a direct primary care doc, got tested for $75 all in. How do you have $75 versus $6,000? So until we have transparency and we know what that protocol is and should be expected, these hospitals are going to game and defraud the system. Yeah. And transparency will provide that. But let me give you something else.
Okay, so bottom line, are the hospitals winning or losing with COVID? I'm curious.
Well, if somebody gave you as a hospital hundreds of billions, they got $200 billion so far. Okay. Mm-hmm. Yeah. That's just for a couple of months of having a downturn over a couple of months, right? Mm-hmm. That's $200 billion. They want another $100 billion and have a handout and bailout. So I think they're pretty much ahead of the curve on that. Mm-hmm. Plus they're out fundraising. In every other email, it seems to be a fundraiser for a hospital on top of what they've gotten from the government. But where they are hurting, and I will give the hospitals credit, is one, we have to be thankful for the physicians and the nurses on the front line that are putting their lives on the line in treating COVID. What we're learning as an organization is the COVID rates are really down. Most of the hospitals, the majority of the hospitals in this country haven't even seen a COVID case. Mm-hmm. And where they're hurting is that people are scared to go to the hospital. Mm-hmm. They're in fear of potentially getting COVID, right. And they're staying, and they've canceled the elective surgeries and they've canceled general care. So that's depleted their income. But I'd say the government bailout has well accounted for that. So they shouldn't be complaining because they've gotten this bailout. Okay. But moving forward, the only way we, as the American public, can trust it is they assure us that there's segregation on those who need to be treated or tested for COVID, and that we can go to a safe area for elective care. But more importantly, that our finances are safe from financial ruin, from being price gouged or fraudulently billed as consumers. And the only way we can do that is back to COVID phase 4 stimulus is getting price transparency and empowering us by making Congress act to codify the Trump administration rules, giving us the power to shop and,
who could
get
deny,
care we can afford.
Who could ever deny, except the people who are profiting from it, that price transparency is not a good thing? Of course, it's a great thing. So let's hope that happens. Cynthia, thank you for your hard work on this. Give out your website.
Well, let me just ask one more thing, Jason, and is that for any of your listeners who are obviously they're so financially astute and have a voice in this country, to use their voice now in this moment of time, and they can go to our website at patientrightsadvocate.org and go and click on the ability to communicate to their congressmen and their senators. It will automatically go based on their zip code and write in their own words that they support price transparency and they want it in the phase 4 stimulus.
Very important. Okay, so where do they go? Where do they go? Exactly.
They go to patientrightsadvocate.org. Patientrightsadvocate.org.
Okay, patient is singular, rights is plural, that's right, and advocate is singular. Patientrightsadvocate.org, right?
Correct. Okay. And then they can go to our website and easily click on a button, which will automatically send their words to their senators and their congressmen based on where they live and their zip code.
That's fantastic. Good. So they don't even have to figure out who their senators and congressmen are. So that's excellent. Good. Everybody, please do that. Cynthia, thank you so much for joining us.
Thank you, Jason. It's a pleasure, and thank you for all you do to help us as American people, get the best health care at the right price.
Absolutely. Thank you so much for listening. Please be sure to subscribe so that you don't miss any episodes. Be sure to check out the show's specific website and our general website, hartmanmedia.com, for appropriate disclaimers and terms of service. Remember that guest opinions are their own, and if you require specific legal or tax advice or advice in any other specialized area, please consult an appropriate professional. And we also very much appreciate you reviewing the show. Please go to iTunes or Stitcher Radio or whatever platform you're using and write a review for the show. We would very much appreciate that. And be sure to make it official and subscribe so you do not miss any episodes. We look forward to seeing you on the next episode.